Hello, everyone. Welcome to the Annie Education Forum monthly call. This is our fall webinar series. I am Hannah Knoll, and I am the Director of Member Engagement and Professional Education here with the Alliance of Nurses for Healthy Environments. Today, I am excited to introduce our speaker, Dr. Carol Ziegler, who is a professor at Vanderbilt University. Today, she will be talking about utilizing case-based nursing learning tools to integrate climate justice and resilience in nursing education. I will pass it over to you, Dr. Ziegler, and let you introduce yourself.
Thank you so much, Hannah. Thank you all so much for coming today. I was sharing with Hannah earlier that I got my start at this work really through Annie. So many, many years ago, I was really frustrated at the impacts that my patients were seeing. I'm a family nurse practitioner here in an underserved community. And I was Googling, like, aren't there nurses working on this? And I found Beth Shank. And then I talked with her, and then I got invited to Annie, and I was the co-chair of the climate change committee years ago, but have always stayed sort of plugged in. And I just was commenting also the call that Millie led last week, I think the Nurses Climate Forum. I'm really amazed at the work and the success that you guys have had, just bringing people to this and the education. So I want to say thank you all so much for all of your work and for being here today and inviting me. So I'm going to share a very specific activity I developed for a course and how it can kind of be pulled into other courses as well. Um, what we're kind of going to do today is to explore the development and implementation of this sort of three-part interactive case-based learning activity that was designed to integrate the political determinants of health, planetary health, and climate justice through the lens of the exposome model. So it's a lot of really complex models that we sort of brought all together. And at the end, the students really felt like the case activities and the projects they did really helped them kind of solidify these really complex concepts into a workable framework where they could actually use them in practice. So it was really exciting. We developed this at Vanderbilt here at the School of Nursing. And it really has served as a scaffold for future coursework, other coursework, and sort of deeper integration of planetary health and climate justice across the curriculum. And so what I hope this does today is sort of supports you guys in finding ways to embed these principles into competency-based education, right? So we also are thinking about the new AACN level. Well, they're not super new now, but those level 2 competencies. So I'll talk about those and how we meet those. And then really think about how we embed planetary health principles into competency-based learning using case-based learning. Um, and sort of this really complex idea of teaching planetary health, that interdependence of human well-being and the natural systems that sustain it. It really demands that we as nurses integrate ecological awareness, systems thinking, advocacy into clinical and community practice. And case-based learning is such a powerful instructional strategy that really aligns with competency-based education and really engaging students in that sort of authentic, complex, and contextualized learning experiences. So that is what we're about to get into. So the objectives for today are to identify strategies for designing effective case-based learning activities that integrate climate justice and planetary health in our curriculum. And then evaluate where do we put these things? Like what's the optimal placement of case-based activities within curricula to integrate this content within the framework of those competency-based learning essentials. Um, and so we're sort of trying to pull all these things together, which has been pretty complex. I know y'all are all trying to do it now. So I want to give you just a brief overview of planetary health at the School of Nursing, and I've presented this in previous Annie calls, so I don't want to spend too much time. But we really got started with sort of community conversations. Annie was included in those in 2016. 2018 to 20, we had a planetary health policy and social justice class where students did community-based projects in planetary health, and they had to also account for in any carbon emissions they caused with those initiatives, and they had some great projects. And then after that, we sort of were thinking about ways to embed this across the curriculum. We had then the planetary health sort of framework came out until we're able to use that. So we've now embedded it in our advanced health assessment courses through cases. This course, which I'm going to share with you today, is Advocacy for Health Equity, which all students take. It's part of a 3-course series. We have about 1,000 students at the School of Nursing at any given time, from MN to MSN to DNP to PhD, and they all have to have this course series. So they're all getting it at some point in time. And then we also have embedded it into our primary care courses, our DNP policy courses, and some projects. So the concepts that we have integrated into the course and these cases and really were instrumental in sort of operationalizing those. These are the sort of concepts. So just to make sure we're all on the same page, case-based learning is an active learner-centered teaching method where students analyze real-world or fictional scenarios, known as cases, to develop solutions by applying their knowledge and critical thinking skills. And then the competency-based nursing education is that really student-centered approach that focuses on skill mastery of specific knowledge, skills, attitudes, and competencies rather than just completing courses or accumulating hours. And I know a lot of us are going through this shift, and it's hard within a university structure to really figure out how do we really implement this on the ground. So we are working on that now. The AAC and Essentials, I'm sure you all are familiar with. Planetary Health, I'm sure you all are familiar with. It's that field of study that examines the interconnections between us and our health and the health of the planet's natural systems. It does focus on how human activities have caused disruptions. So that's why we need to bring in these other concepts, right? So I feel like the exposome, which I'm going to talk about in a second if you're not familiar, social determinants of health, which we have done a pretty good job of embedding those in our curriculum to date, the political determinant and commercial determinant. So these all really to teach advocacy from the planetary health paradigm, we have to kind of include all these concepts together. They're very complex. So the cases give us a really good scaffold to bring all these things together where students can understand. The political determinants of health involve the systematic process of structuring relationships, distributing resources, and administering power that sort of impact our health and the health of communities. And then the commercial determinants are those private sector goods and practices, such as marketing of unhealthy products, lobbying, et cetera, that influence health issues. The exposome, I feel like all these topics need like a 2 hour a 2 hour webinar, but the exposome is this framework that is really useful in getting students to think about ecological impacts on their health and also advocacy. So if when we see patients, we can think about their health in terms of what they've been exposed to, then it also gives us a starting point for where to start advocating, right, to decrease those exposures. So the exposome is a great framework. There's a reference there. I encourage you all to go kind of dig into that if you haven't already. But it really is just the cumulative exposures of a person across their lifetime, even in utero, even beyond. So what their grandmother was exposed to, how that's infected their epigenetic system, how relationships affect you for better or worse, right? Everything you're exposed to across the life course. So physical, biological, chemical, and then socioeconomic, lifestyle, and psychological. So we bring all these things together within this course. And then those commercial determinants, again, are really important targets for advocacy work. Because when we look at the ecological impacts on clients and communities where we're working, right, we have to eventually get upstream. And that's really what planetary health is about. So how can we leverage political determinants, commercial determinants, social determinants to really have an impact for the people that we are taking care of? So this is sort of a really quick and dirty schematic just for how to think about the course. So in the center is really the planetary health framework, both for education and as a meta paradigm. And then connected to that, we pull these threads, right? So we pull in the exposome, the political determinants, commercial and social determinants of health. And then I'm going to show you kind of how we operationalize that within the course. We really stress the students because we have MN program, which they will graduate and be bedside nurses, and we have APRN, so multiple specialties, family nurse practitioner, midwifery, adult, acute, psych, pediatrics, sort of ENP. We have different programs, and we also have a doctoral program, a DNP, and a PhD program. And in all programs, especially the primary care focus tracks, we really focus on health span and health optimization. So that photograph there is not showing up well, but that's essentially those overlapping practices that through the Blue Zone studies have shown kind of optimized health span. So we kind of always bring them back to that. And so how we look at health span is really through this lens of planetary health, those three determinants, social, commercial, and political, and the exposome, and how all those things connect really then leads us to how we can advocate for health equity, which is the name of the course. So I want to talk about now how case-based learning sort of fosters this connection. And so we have competency-based nursing education, and I'm going to mix these up, y'all, I'm sure. Case-based learning and planetary health. So planetary health really requires this contextual and systems thinking, right? It's so broad. It is literally everything under the sun, right? And then we have case-based learning, which sort of traces those upstream determinants to patient outcomes. It promotes systems thinking and that consideration of multi-level interventions. And then it really helps students shift from disease process thinking to sort of ecosystem and societal resilience thinking. Planetary health really sits at that intersection of ecology, social, commercial, political determinants, the exosome, and human health. So it's a really good way when we bring all those things together to help the students trace like how heat waves, pollution, food insecurity, water scarcity, how those trace back to patient outcomes. And then that really nurtures that systems thinking when they put these things in practice. So some other reasons why case-based learning is so important is it's really a key element of competency-based education. It's especially effective for integrating planetary health. It helps sort of scaffold competency development in planetary health if it's integrated early and frequently across the curriculum. It supports critical thinking. The most powerful impact I feel like it's had based on student feedback, and this is why we're looking at really using cases like cases of families. Like say we have 5 different families and we use those across all classes because that students can identify and they have sort of an emotional connection, and it just helps them then solidify concepts, and it just helps with their learning and retention a lot when they have those emotional connection to a person and a picture and concepts. It really provides family and local context for these very, very abstract concepts that we're trying to get them to learn and utilize. And it's really a key step between didactic content learning and then immersion or experience, which is really key for competency-based education, right? So in this course, we have didactic content and sort of we introduce a case, then and they do that sort of quick and dirty live in class. Then they have the online unfolding cases, which is what I'm going to share today. And then they do a project in the community. And they've already sort of had these two platforms to sort of practice those steps and that work. Case-based learning is more passive and reflective in preparation for that experiential learning. And I think especially with planetary health, it can feel so broad and sort of theoretical that tying it really to nursing education and health impacts, the cases have really helped us with that. So this was a key thing. We were like, we have to map it, right? We're mapping all of our curriculum now. So there's a the case-based learning really helps to prove authentic assessment, right? It's really tied to that demonstration of competence. And so the cases really provide that authentic assessment opportunity. So we have these planetary health infused cases where students analyze data, they make clinical decisions, they propose prevention strategies and advocate for community interventions with this very complex context, and then they're more prepared to do that out in the real world. There's these very specific, like authentic performance tasks, and it is mapped to competencies in leadership, advocacy, environmental health literacy, and systems-based practice. And those are just the numbers. So for this particular case activity, we've mapped it to all of those AAC and competencies. So the case-based learning also really supports interprofessional and reflective competencies within those that AAC and scaffold. And so planetary health is inter isn't a broad enough word. It is all the disciplines, right? And it is vast. And so it's sometimes it's too complex really to find ways to integrate it. It never falls within just our discipline or anyone's discipline. The learning has to include partnerships with public health, urban planning, community-based organizations, policy actors, engineers, et cetera. So another key aspect of that is learning how to work in teams. So the case activity sort of reflections include things like cultural humility, equity, sustainability, ethics. So those are all other aspects of those AEC and essentials that are sort of embedded in these courses that we can then map, right? Um, and it really enforces those effective and ethical competencies so that students are gaining those sort of, they're scaffolded well, I guess I would say, as we go forward. So the cases are anchored in competencies in real practice. So, for example, the case that we use is going to look at asthma. So, managing an asthma exacerbation in a child exposed to poor air quality that really requires linking clinical care, environmental determinants, and advocacy rates that have an impact. So, it's very performance oriented, and that's one of the most difficult shifts is us going from, paper and pen testing and clinical hours into like really how do we assess competency-based performance. And so we really need to emphasize observable skills and behaviors rather than just abstract knowledge. So there's a process, right? And these cases I think are really important for building that scaffold between the didactic learning and the real world application. Um, it includes things like systems thinking, advocacy, ethical reasoning, and that intersectoral collaboration. And it really allows students to apply those and not just describe them. So this is a table that just sort of outlines sort of broadly different features and how they relate to planetary health and then outcomes for learners. So within these cases, we have these different features. So one is authentic context, complexity and uncertainty, collaborative problem solving, and then reflective integration, and how that relates to planetary health, right? So for authentic context, we have to think about connecting ecological determinants to real patient and community experiences. And then the learners get to sort of learn about systems thinking and practical problem solving. They have to do that within the case, right, to meet that objective. The complexity really kind of mirrors real world health environmental interactions, and it builds this sort of adaptive expertise and ethical reasoning, which also has to do with the student's own learning and resilience, right? And then it involves also collaborative problem solving. So it really, I would say more than encourages, it requires interprofessional and cross-sector collaboration and engagement and really strengthens then those teamwork and leadership competencies. And then when they do their reflections, it really links personal, professional, and planetary health values. And then that sort of helps them develop this self-awareness and moral agency in sustainability and advocacy work. So this is a course. So I'm going to talk about the course broadly and then the specific activities and specifically related to the case. So the course is called Advocacy for Health Equity. It is one of a three-part series. All students have to take it. They have synchronous and asynchronous lectures and learning experiences, online course modules, and then assigned readings. We use podcasts, YouTube videos, all different sorts of materials for them to learn. And then there's sort of required activities within those modules. It's really centered around group projects that facilitate interaction and really model true advocacy. And then after this course, the next level course is advanced policy. So that's when they really have to kind of take it up a notch beyond sort of the advocacy work that they're doing here. So the course objectives are to propose strategies to mitigate the influence of social determinants, systems, and policy on health outcomes for individuals, communities, and population, advocate for policy change to promote health, and apply the principles of planetary health to the health of populations, and then appraise system readiness. And this is the text that we use. I don't like textbooks, but I elected this one because to me, students are pretty well versed by the time they get to this course in planetary health and social determinants. Political determinants model is pretty complex. So this sort of helped them get a scaffold for that. And the readings are really focused on how that works. And it really informs their advocacy work. So I think it's a great textbook. And it's the one that we use in the course. So I want to now give some examples for the case activities themselves and the learning activities. And these are pretty easily mapped to AAC and Essential. So as you're building cases and assignments in your courses, these are some good examples that sort of integrate all of these complex issues together. And these I took directly from different aspects of the casework that students were doing. So one is to apply the exposome lens to a health equity issue, to analyze the root causes of key global health inequities, and recommend advocacy strategies to impact political determinants and health optimization. This next one, prioritize targets for work. That is a lot of times the most difficult thing to do. And I think in the feedback from students, that was the thing that they said, one of the things that was most helpful is if you're working in a community setting and there's all these really complex ecological, political, social issues that you're trying to impact to really have upstream effect, and advance the needle on health, allowing people to reach their optimal health span, be as well as they can for as long as they can. How do you choose what to do first? That's always been a struggle for me. So we really talk about how to do that within context, who needs to be at the table. And I think that was something that really came out as it was a learning objective that the cases really helped them to me. Then they also need to be able to apply the principles of these different models to various health inequities. They construct a web of connection between all these different complex ideas for health outcomes of populations, and then apply these principles to specific case scenarios. Then that last one there, that has to do with their project. So they have to use evidence in their position to advocate for a key health optimization strategy. So the structure of the course is we start with sort of this didactic work, right? Like you have to include that, right? So it's the political determinants of health, planetary health, social determinants of health, commercial determinants of health, the exposome, and then advocacy, because the course is really about advocacy. So how do you actually do that? And the advocacy is also embedded in the resources we use. So, like, for example, in one of the modules, they're learning the didactic content is a podcast that actually was a Peabody Award winning podcast about housing inequality in Nashville. In our community, we're in Nashville, by the way. I don't think I mentioned that. So, students are kind of learning about advocacy strategies as they're going through the content, which they also mentioned was helpful. Then our course is hybrid. So we meet once live in person during orientation, and then we have Zoom meetings throughout the rest of the semester. But that live meeting is about 4 hours. It's brutal. And we, do course orientation. We introduce the concepts broadly, but without them having done a lot of deep reading or diving into didactic work, we sort of throw them in with this case activity. So we first introduce the case, which I'm going to show you in a minute in class. And then we pull, social determinants, commercial, political, and exposome and planetary health. We sort of have them meet in groups and pull all these threads and relate it back to the case and relate it to a potential health advocacy strategy. And then they do sort of peer-to-peer teaching where they share out what they discussed. And we sort of call it like a quick and dirty foray into what you're going to be doing throughout the class. And while they all are terrified at first when they come in, we sort of walk them through the process with faculty experts. And then by the end, they sort of feel like, okay, these concepts are very abstract and complex, but it shows them that they can, how to really pretty easily operationalize them with activities. So that I think was a really important part of this. Then the cases, which I'm going to really talk about the most, they are developed in an online platform. We have this amazing team at Vanderbilt. They're called D3. I don't know what it stands for. Divine is what I would say. These amazing people who we can give content to, and they will create these amazing cases in our online learning platform. And so Diana Vasquez is the person I worked with, who was just spectacular. And I'll show you some screenshots of the work that they did as we move through. The cases get progressively more complex. So we used a 3-part series of an unfolding case with the same family, and then it gets progressively more complex as they move through the weeks. About one aspect opens about once a month. So the case is 12 weeks, it opens, and then by the end, they're really doing their projects. It is a formative assessment. So they go through and there's stories that they sort of read through and content, and then there's questions and they click on the questions. They can't move to the next one until they get the right answer. So and the platform gives them feedback. So if they click the wrong answer, it tells them why it was wrong. So it's very formative. And then it also utilizes recall practice with those, I wouldn't call them quizzes, but they're question and answer sessions that has been shown to be really effective in helping students retain information. So we sort of brought all those aspects in together. And then after that, they start working on their community projects in groups. So these sort of 3 steps, the live in-class activity, the unfolding cases, sort of all get them ready for then doing this work in the community. So they have this sort of really strong scaffold. So this is the case that we used, and it really, to build the case, I just took a conglomeration of different families I was working with in practice and the issues they were dealing with in real time. Now we did, as far as time goes, we had to build the online platform, obviously before class, right? Because it was probably 2 months of work to get that together. And then the week that the class launched, it was last summer, that particular week in Nashville, we had a lot going on. And so we pulled in like news sources, and I'll share that in a second, to really drive home the point of what families were facing and how can we sort of help sift through this and navigate in partnership with communities to really have good health outcomes for everybody. So we use this family throughout the course. I also want to say, in case I forget, my dream for nursing education at Vanderbilt is that we have like a series of, say, 5 or 6 families in which we can teach all content through, right? Because I've really found the students, it helps them connect concepts across courses, and they have this emotional connection then to the family. It's like they feel like they know them. So I would love it if, like, say, for this family, we could use this family to teach health assessment and adult primary care and all these courses, just using these sort of characters. So I think it's a really effective way to teach. So this is sort of the background of the family. This is sort of real issues happening right here in Nashville, right? So it's a family that resides in South Nashville that has a very diverse population and really rapid gentrification, urban development. The family rents a small two-bedroom apartment in a building that's near a major highway and a petro facility. The building has mold issues, an unreliable heating cooling system. Public transport is limited, and the mom relies on rides from coworkers to get to work and take care of her children. So this is all, very very real what's happening with families in our community. So we introduce these characters to the students, and in the in-class activity we talk about the son Carlos, and he's having an asthma attack. And then in the online cases, we are talking about the sister. But you can see how you could pull different characters for different courses, right? Or different activities. And it really helps the students um, learn these learn practical applications within the context of family and community, right? Which is holistic and really how we want them to learn to practice. So literally the week that we met live, in our city, all these things were happening. So the Dollar General store, which in this community was the main source of food, was shut down. Um, there was also a lot of ICE raids within that week happening in this community. And then we pulled some other data, news headlines for the students to be aware of. So you can see how sort of the complexity, how it pulls in commercial, political, social determinants all sort of at the same time. Um, One other thing that happens in my community, which I was not aware of until a couple years ago, is um, payday lenders are used as utility bill payment sites. So you can see that can be very problematic. And so that there's also a lot of financial exploitation in this community. We have data on shootings and also educational access and educational disparities within the community. So the students it's setting the stage for the issues they're going to work on as part of their health advocacy projects, right? Um, and it really connects the social, commercial, political determinants and the exposome together with this one family. We also share this information and we encourage the students to participate and know their community, because they're not all in Nashville, but we encourage them to really get to know the communities where they work. So we talk about windshield surveys and how important those are. And so in this particular community, this is the information we give them, that only, a third of the units have air conditioning. And in Nashville gets very hot with really high heat index. We talk about the risks for people who don't have access to AC with just cooling. And then we connect that back in other courses to commercial activities, climate change, carbon emissions, right? So we're sort of trying to tie all these loops together throughout the program. We talk about urban heat island effect, green space, groceries, schools. Again, so all these sort of pieces, then we connect back to those social determinants that it gives the students ideas for areas of focus for their projects. So in that initial activity where we introduced this case in class, the students then go into breakout rooms. In one room, they discuss the exposome, another, they discuss social determinants, commercial determinants, and then political determinants. And we give them these very specific questions to discuss in the room. They all discuss the questions there on the right, like how do structural vulnerabilities intersect. And then they share out to their peers at the end of class. And I'll share these slides with you all at the end. And then we ask them to apply the political determinants of health model to this particular case, right? And this is all over, the first couple of weeks of class. So they have that live activity together. They're discussing it, thinking about, then they leave class and do this on their own and sort of reflect, think about it, write it up. So they're learning to apply these concepts in real time. And then this sort of reflects the issues that came up just in the class discussion. So around the different topics. So around the exposome, they talked about the proximity to the plant, the highway air pollution, indoor mold, secondhand smoke, rubber mulch, all these different aspects that they're really learning about how they impact people's health. They talked about developmental exposures, psychosocial exposures. The group that did social determinants talked about economic instability, educational access, healthcare access, and the neighborhood and built environment. So these are ways that they're sharing out with their peers. And then, so after they have that discussion, then the next sort of assignment they have is to move into this online case, right? So they did those in groups. And then this is a screenshot of sort of where it starts. So the first case is looking at asthma management and planetary health. And I hope you can see these screenshots. So it takes the daughter and talks about she has moderate persistent asthma. She lives with her mom and dad in a two-bedroom home. And then it talks about, she's exposed to tire mulch on the playground. There's a series of questions like what exposures can you identify that impact her asthma? They can select all that apply. And then because we want them to also learn to use tech resources, right? I forgot that one for y'all. And that's one of the AAC and essentials. How are they using technology and informatics? And so we use the Purple Air map. I don't know if y'all are familiar, but the Purple Air is a citizen science project where you can open up right now and click on your city and block by block and address by address. If there's a monitor, you can see what the air quality is. So they look at that for this particular community in this map because these are patients. I have patients in this community that have asked me for monitors. So there are some real-time data that they can see, which is really interesting, and they can see it over different days how heat impacts air quality. They can see how different businesses in the community impact air quality through some mapping exercises. So it's really beneficial to their learning. And then when they leave, they have these tools that they're aware of that they can use in practice. The second unfolding case, so this is the same family again, we're just moving forward, and this opens the next month. Again, they look at it gets sort of more complex. So they look at health risks that the people are facing. They look at heat index. They start to look a little deeper at commercial and social determinants of health. And then they ask them questions, which that helps with that recall practice and sort of solidifying concepts. And then the last part, this is getting them ready to go do their projects. It really looks at advocacy. And so for this part, again, they've now been exposed to different media resources and storytelling strategies, because that's really what their project is about. They are effective for really moving the needle, right, for people. So you can see the different questions. We talk about different strategies for advocacy. So one of the questions is, after a year of advocating for sustainable health practices in your community, you need to evaluate the success of your initiative. Like, which strategy would you use? And the content within the case kind of describes different strategies and it links to different sources so they can see how different things are or are not as impactful. So they really get exposed to a broad range of resources with this work. One of the other questions is, you are tasked with designing an advocacy campaign aimed at improving both patient health and environmental sustainability. Which of the following strategies would best address air quality in underserved neighborhoods and promote environmental and health benefits? So they really start to kind of look at and think about, how do you operationalize these strategies to really move the needle on health within this very local, hyper-local context. So this takes us then, and this is sort of what I'm showing you now, are really sort of how we structured the cases. So that's sort of the case-based tool. And then when they start working on their projects, this is the same model that they use, right? So it sort of translates across those three levels: the live class activity, the online cases, and then their projects in the community. So we talk about this sort of decision tree. So how do you prioritize what you're going to work on, right? So first you have to identify the issue. So what's the specific health problem or inequity? Who is affected and to what extent? What are the social, political, and commercial drivers? And then they sort of proceed once that's clearly defined. And we talk about clearly is complex, right, with these things. But this is sort of the meat and potatoes, the hard work that's hard for me to do in my work, right? It's really hard to sort of prioritize and define what you work on first. And the content in case one kind of takes them through this step. And then step two is they map these potential targets. So this gets into power, right? And political determinants. So who holds the power? Is it politicians? Is it corporate leaders? Is it business leaders? Is it the local utility, right? And who can influence the decision makers? So how does media play a role? Community leaders, coalitions. And then we give them a template of a stakeholder map. They use that map to kind of start to identify who are their primary and secondary targets for their advocacy project. And again, within the unfolding cases, in case one and into case two, we sort of start to introduce these concepts, like that they're paying their bills at a payday lending site, et cetera, right? So it kind of lets the students think about how to identify who are the players they need to bring in to have an impact on this issue. And again, we're connecting it back to planetary health. Because at the end of the day, especially when we get into commercial determinants, we're going to be impacting, we hope, pollution, carbon emissions, et cetera. That's the goal. So then we give them they have to create a stakeholder map, and we give them a rubric. And these are some sort of the questions that they ask. Is they look at influence and power, winnability and feasibility, alignment with mission, urgency, research impact, and resource requirements. And we give them these sort of specific questions to ask as they're doing their sort of stakeholder analysis. So can the target directly make or block the change? The target being the stakeholder, right? Are they persuadable? Is there political or public openings to act now? So we talk a lot about if you identify an issue, especially in today's environment, right? Timing matters. There are some issues that you may not want to draw attention to based on the community where you are. So we really talk about that in context with community mentors about how to navigate all those things. And it is messy. It's not, and students want, they want you to tell them, these are the steps you go, this is how you prioritize, but you can't do that always. And so part of what we try to teach them is, like this work can be very messy and the process is really important. So how you partner, how you show up, how you sort of relate these things together, and then how you prioritize things in partnership with community is really how we very slowly move the needle. And we have to consider complex issues like, deportations and people feeling at risk and people not coming to the clinic because they're afraid of being targeted. So we talk about sort of how all those things affect us and what are things that we can do in practice and all the sort of complex things we need to think about so that we don't end up harming people unintentionally, right, through this process. So we talk about timing too. Is action needed soon? Does it need to happen now? Can it wait? Should it wait? Will success affect a large population or address a deep inequity? How can your organization realistically take this on with the resources that you have? So these are all things that we talk through and those cases address through those families and those issues that are brought up within the cases. And then we talk about prioritizing decisions, right? And how we have to constantly review and reassess, right? So the targets may be complex and they may shift due to elections, scandals, policy changes. So we talk about the importance of sort of revisiting priorities regularly. And that at the end of the day, let's say towards the end of the class, if they had to shift priorities, as long as you tell us why, like it's good. We want them to learn the process. So we talk about assessing risks and opportunities. So what are the political or reputational risks of targeting particular stakeholders? Could targeting them strengthen or weaken future alliances? Is there an opportunity for momentum? And that again is really important with timing. We talk about the value of getting something ready, like if it's a piece of legislation or a policy target, having it ready and then so you can rapidly introduce it, right, based on timing. And then so it really gets them to think sort of broadly and in a complex way about these different issues. And then we talk about how you decide and strategize. So you focus on sort of those top scoring targets, we call them, and you tailor your tactics to the stakeholders. So we talk about differences between like public pressure, media campaigns, legal advocacy, supporting communities with resources like CBOs, just getting resources to CBOs that are already doing the work. And this all happens. They've had sort of the basic content delivery with that course and through the didactic material. Then they've had the cases to kind of think through it. And now in real time, they're working on it with community members. So this is for that final project. I just wanted to share this because it's like, where is all this going, Carol, right? So the case is a piece in this, right? But then for their final project, they turn in sort of their priorities grid for advocacies, their stakeholder analysis, and then they build a logic model / implementation pathway for whatever they're working on, right? And all that is submitted. And then their final project is this sort of storytelling deliverable, which could be a podcast, video, art that is really done in partnership with a community to really advance their issue. And then in the policy course, they make that a little meatier. So then they take that, they may create an op-ed or like a position statement, a white paper, et cetera. So the courses build on each other, right? So I wanted to kind of just say that to show you how we situate this within the broader curriculum. Oh, sorry, it's moving me forward. So some strategies to think about why the case-based learning is so sort of important and what are some things that you can use is number one, really think about it in terms of scaffolding learning, right? That's a term that I learned from my education colleagues. So you sort of start with individual patient cases and then you progress to community and policy level systems cases. And I think that's really useful if we think about embedding like planetary health and climate change topics across the whole curriculum. So for example, like in health assessment class, when we talk about lung assessment, we talk about how air quality impacts health, right? It's brief, because we really want them to learn how to actually auscultate and listen. But you can sort of bring pieces in so that when they get to the health advocacy class, it's already connected in their mind. I think the biggest battle sometimes is building these connections early so the learning is a little bit easier down the road. So we're trying to find ways then to just sort of use cases across the curriculum. And again, I think when they know, they feel like they know the family, right? So it makes it more interesting and exciting for them, I think. We use multimodal methods, so pairing cases with simulation, with field work or community projects, like in this case, or systems mapping exercises really helps them learn how to use technology, learn how to work in teams, sort of they develop all these skills at the same time. And then also assessment alignment. So evaluating performance, which is like skills, knowledge, analysis, and reflection for that holistic assessment. And also leveraging interprofessional collaboration. So how do we best, what are best practices, right? To partner with public health, environmental science, social work, community-based organizations. They're learning all these skills in real time and sort of across the curriculum. And really, if you think about it, and I know you all already know this, planetary health is so complex. I have found for things like interprofessional education, like the course we did years ago, it was students from across the university. There were PhD engineering students with first year undergrads. It's the best scaffold for that interprofessional education because it is so complex and you need everyone there, right? So everyone has a role to play. And so it just makes learning really exciting. And I think is the only way to really do competency based because they have to show these skill sets in real time. So also we can embed these things in existing courses. So there's no need to revamp curriculum. We did here, but it wasn't for planetary health, it was for the AAC and essentials. We revamped everything, but I think you don't have to do that necessarily. You can integrate these sorts of cases in adult health, community health, leadership, ethics. You can integrate it in research courses, right? Rather than just creating new sort of standalone models. And then we use like that progressive complexity model. So we start with simple patient cases, or like in this course, because it was more community focused. We started with them doing sort of that quick and dirty work real time, where they sort of went through the whole process in a couple of hours. So then it gets more and more complex as they go forward. And then we sort of evolve to those community policy level systems cases. And we'll use these same cases in the policy course. We use the same family. Then we can also map it to competency-based nursing education framework. So like literally to the AUCN practice essentials, right? So you can align each case pretty easily to domains like patient care, systems practice, population health, from those essentials. It really makes it easy, I think, to link your course objectives and the learning objectives back to the AUCN essentials if you're doing that in your programs. And it really lets us assess the student holistically. So they're combining knowledge, performance, and reflection-based assessment. So we can really say, are they competent? Like they know the concept, they can apply it, and they can put it into practice in a competent fashion. So I'm going to share some ideas for cases as we wrap up here shortly. Um, so thinking about like I like to focus on heat and air quality because in my community, housing instability, heat, air quality are the things that are the biggest pain points for people. And so a case on heat-related illnesses in a low-income urban setting, you could look there at clinical competence. So we could look at things like dehydration, heat stroke, how does heat impact someone with hypertension? All these different disease processes we can bring into that case. We can look at then systems thinking, so housing inequality, infrastructure, urban heat island effects. If we had an arboretum or forest, that really gets into proper planetary health and mitigation, right? How would that come into play? Or green roofs, et cetera. And then looking at advocacy competence as well. So proposing those sort of intersectoral interventions like cooling centers, policy changes, urban forest. What are things that we can do to sort of move the needle? And then partnering with local public health or agencies to educate people in the community, right? So that then gets that communication and education competency. Um, and I think also having students work on real projects, like making assignments actually have impact in the community. No one wants to work on what they call busy work, right? So I think having assignments that build. So for example, students that are in the health equity course now, they can use the same topic for the policy class. They don't have to reinvent the wheel. So they don't have to go back and redo a lit review and redo all that. When they get to policy, they can take what they did in health equity and then use that topic to write their white paper or their policy piece. So I think making sure we're building really facilitates that sort of deep learning that students really appreciate. And this is what we heard back in student evals from using this method. So students said really across the board, they felt prepared to do their projects because they had already kind of seen what it was going to look like and work together in teams. They felt they understood the concepts. Those sort of multi-layered activities really help them understand and connect those things together. So again, connecting, people thought I was crazy when I was like, we're going to bring in all these different layers, like planetary health, commercial determinants, social determinants, but they really go together nicely. And the cases and the multi-layered activities really help students to link those all together and then operationalize them in practice. And the online cases and the storytelling, they said, really fostered the practical understanding of those ideas. And it also, they mentioned time and time again, they felt excited about the work. They felt invested in like when the case would unfold, like what's going to happen next to the family, right? They had this sort of emotional connection. And I think generally, I know this is true for me in learning. When we think about clinical hours in practice, that one of the biggest sources of value in that experience is the relationship piece. It just really facilitates learning when you actually care, right? It's that caring thing when you care about the person. They really started to care about these families, even though they were, fictional and case-based. And so I think having a system where they can sort of interact with that same family or a group of families across the curriculum really helps them retain and have sort of deep thinking. It makes the curriculum kind of come alive for them and make it very applicable. They did request that the case would remain open all semester. So when we offer the course again, how we're going to deal with that, I think, is we don't want them to jump ahead, right? So we want them to finish case one before they go to case two. But we could make it so, and you can design this on your online platform. So when they finish case one, case two then opens, but they can finish it at their leisure, right? So if they wanted to work through all the cases in the first week, we don't advise it, but they could. But they still have to do them in sequence. So that was some of the sources of feedback that we got from students. And here are some references, and I'm going to stop sharing. Thank you all so much. And I see there's things in the chat. Okay. Does anybody have any questions or comments? Hey, Millie, I see you.
Sorry, all. I'm not Hannah. I'm just on her line covering. Yes, yes, I snuck in. First of all, thank you, thank you, thank you. That was an amazing presentation. Very informative, incredibly engaging. Let me just quickly check the chat. I don't I don't see anything in the chat at the moment, but please, if anybody does have any questions, this would be a great time to put them into the chat while we still have Carol with us.
Thank you all so much for being here. And thanks for having me, Annie. People.
Oh, please, we will have you any day, anytime. We appreciate that. And so, as Carol said, you will be giving us the slides to share. That's okay?
Yes. And I tried to screenshot it, but it didn't look good. I made like a table that had some examples
Yeah.
of how to integrate some of these concepts together. Yeah, so I'll share that with you as well. Just a word format.
Appreciate it. Oh, okay. We do have a comment from Miss Kelly McAdams. We used the family teaching method in an advanced adult health course, and the students loved it. They really became invested in the family throughout the semester. This was a fantastic presentation.
Thank you. I think that I really wish I want this to be the core of how we teach here. And I know it's a heavy lift, but I think you just need like a library of a couple of families and you can literally teach everything from that.
I believe it. I believe it. And is there, I heard you mention that earlier. Is there any maybe conversation about that, about going forward with that?
We're having it here. We have there's a lot of changes happening. So we're trying to map the whole curriculum to AUC, and I'm sure you all are going through this, right? They're looking at the admissions cliff. Like there's all this stuff happening in nursing education broadly. But yes, at least within the family nurse practitioner program, we are thinking about doing it within our program. And then there are several courses where all the students across the curriculum, no matter what specialty, they take those courses together. So I think at least within FNP for sure, we're looking at kind of building this out. Yeah.
Excellent. And we do have a question from Mickey Meadows Oliver.
Yes, hello. Thank you very much. This was very informative and I do appreciate it. So I know you were talking about doing it like in the nurse practitioner programs. Like, do you think it could be scaled or used somehow like in the baccalaureate programs? Like we have a large, I guess like accelerated population at my school. So like we just admitted like 320 for the fall. So I just wonder how something like that might be like used in a big setting or with baccalaureate students or something like that.
Yes, so I would say, well, first of all, that makes me excited you have that many students because then there's people coming into nursing. So I'm happy to
Oh
hear.
yeah, and we admit twice a year.
Oh, great. That's wonderful. So we do use it in an MN program, which is similar, because they end up getting their RN as they come through the program. So yes,
Mhm.
absolutely. And I think especially with like community, they do like a community nursing course, don't they? And
Yes.
yeah, so especially in those courses, I think it's very applicable.
That's a good point because
Yeah.
we have it's just I think one class on it now, but we also are revising based on AACN and we're implementing a new curriculum starting soon. But yes, there is a class on environmental health, but like just that one little portion, so maybe it just could be expanded or something. And I like your idea of somehow like weaving and threading it throughout. Like if they are introduced to this family because our community is in their final semester. So it's like maybe if they are introduced to some of this before the final semester, this like in the community course could be the culmination.
Yeah, I think that one of the things that's helped us here is the sort of the building, right? So that this at every level it sort of builds on. I think the students really appreciate also that they can use the same topic. So they because they're so
I can see
busy.
how
I
that,
know
yes.
with accelerated programs, I know they're like they just don't have time and it just feels overwhelming if they have to restart the wheel. So I think it's fine for them to kind of yeah, to be efficient.
Oh, thank
We
you.
say work smarter, not harder, right? That's what we
Exactly. They would appreciate that too.
Perfect. I love that question. Um, any other comments or questions? If not, I do want to remind everyone that CEs are available for today's session and to encourage everyone to please register for the November and December calls as well and for the School of Nursing commitment. If there are any questions regarding today's session, again, I'm not Hannah. I couldn't be Hannah if I tried, but I will drop Hannah's email into the chat and feel free to email her. She will be looking out for any questions that she can answer.
Thank you. And I'll share with Hannah my slides and that Word doc with the table.
Okay, perfect. We appreciate that. Thank you so much.
Thank
So with
you.
that, if there is no more questions or comments, I will, I guess, gift you all back the last 5 minutes.
Thank
Thank
you
you.
all so much. Thank you, Millie. Thank
Thank
you,
you.
Mickey.
Oh,
Mickey, sorry.
the Hannah's email in the chat.
Oh, thank you.
Yeah.
Have a good day,
You
everyone.
too. Thank you. Millie, are you the host? It says if I leave, it says I'm going to end it for everyone, so I'm not going to do that. Don't want to end it for
Well,
everyone.
I tell you what, I do have to, in order to secure the recording, I do have to end it. So I'll go ahead and do that on my. Are you co-hosting? Because
I am, because I can see. Can I stop recording now? It says I can stop it. You want me to stop it
yeah,
now?
I'll stop it.